May adlaw na tong tanan. Does your leg feel stiff, difficult to bend, and too rigid? And that happened after a stroke, traumatic brain injury, or spinal cord injury, or any other neurological disease. If so, then this video might help you. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. After a stroke, traumatic brain injury, or a spinal cord injury, there are two synergy patterns that usually happens. One would be a stiff but bent leg, so it's difficult to straighten out, and the other one is where your leg is too straight, stiff, and difficult to bend. In this video, we will be managing a leg that is too straight, stiff, rigid, and difficult to bend. And we will be on your couch so that we will take advantage of gravity-assisted movements. And this will be for the initial stage where it is really difficult to bend that leg. And since this is therapy that you can do at home, you will use things that you find there, like a belt and a pillow. So let's lay down on your couch. All right. If you need help, ask for help to lay down on the couch. First, we need to flex or bring this leg. So let's pretend my stroke leg is my left leg. We want to bring this leg down and bent forward from the hip instead of being extended backwards like that. Okay? And you will need your belt around that leg. You will need this in order for you to assist your leg in getting back up. Okay? So scoot back a little bit because you need to lean forward a tiny bit more and slide that leg down against gravity. If that is difficult for you, use a pillow between your legs. Okay? And position it where it's slanted going down. Now try to stretch that leg down just like that, okay? And stay there for 1 minute or so until you have a good stretch from the hip going forward, okay? If you need to help it in stretching, use your other arm or the belt, okay? Be patient here and stay there for 1 minute. Once you have a good stretch from your hip, we're going to do active assisted or active movements from your hip in bringing that leg down, okay? Down and forward. So bring that leg up using your belt and then actively move that leg down like that, okay? Bring that leg up again and slide that leg down like that, okay? So let's try to do 3 more. Good. Be patient with your leg. Remember, practice is necessary, repetition is necessary, and patience, okay? So 2 more times. You don't have to have big movements yet. Remember, we are training our brain to control the movement, okay? And slide 1 more time. And that is how you exercise your hip. Next, we're going to stretch the knee to bend because that is usually stiff with a straight leg. It's difficult to bend it. So what you want to do is to put the belt around your ankle and lay down on your couch diagonally. Then try to bring that leg off the couch. Initially, it will be very hard for that leg to bend. So you're going to just be patient here and let gravity assist in bending that leg or that knee to a more flexed position, okay? So it might take days. You might be stuck here for a bit. I mean, in this position, the knee being straight like that. But please be patient and stretch that knee as many times as you can and as much as you can, okay? So with gravity, it should pull your leg, your lower leg down. And once you're able to touch the floor, that is a good indication that you have stretched that knee. Okay? So do that position. Again, you're going to just be on the couch. Slide your stroke leg off the couch. It might be straight initially and let gravity pull it down. Be patient here. Once that foot touches the floor, that means that your knee is already stretched good. Okay? So what you want to do is to stretch that knee to bend further back. Use your belt, using the side, the good arm, to bring that foot back even more. Okay? Again, be patient here. Do not yank it because you will cause it to rebound. You will cause that leg to rebound to a more straight position again. So just be patient here. But if you are still stuck like that, wait until that foot touches the floor. Okay? And then you can proceed to this further stretch. And that is how to stretch your knee furthermore. Once it's easier for you to bend that stroke leg, once it's easier for you to bend that stroke knee, once it is easier for you to bend that stroke knee, you want to do more active movements with it. So lay down on your couch closer to the armrest. Okay? Bring that leg up. And you will need a pillow that will allow your leg to slide, the foot sliding off the pillow. You might want to support the pillow with your other leg, your good leg, and your affected leg with a belt, because you will need it in order for you to bring it up again. Okay? So try to position that belt where you can straighten it out a little bit more. Alright? So you're going to get that leg a little straight like that and slide the foot down from the pillow. Try to find a pillow that would allow you to slide that foot better. Okay? So kick that leg out, bring it to a straighter position, and slide that foot down. So you're going to actively contract your hamstrings in bending that leg. Okay? So again, let's do that maybe 10 times. Alright? So slide that foot down. Bring it up. And slide that foot down more actively. Let's do that 8 more times. Okay? And 3. Be patient here. 4, 5, 6, 7, 8, 9, and one more. 10. And that is how you exercise your knee using a pillow. Right, the next exercise is external rotation of your leg. Okay? So since you're able to bend your knee better, keep it bent, then put that belt around your thigh. So you want to actively bring this leg down like that, external rotation, pointing your knee outwards. Let gravity assist you with this, but try to engage the muscles here in your butt, right here, to externally rotate that leg. Now, if that gets easier, so let's pretend my stroke leg again is my left leg, so you can see better. You lay on your side, like that, okay? So you're just going to keep your feet together, and you're going to bring your knee together, in and out. Okay, so you're going to bring that knee out actively and let gravity bring it back in. Okay, or you can also pull it back in using your belt. So again, let's try to do 10 times. Okay, 1. You don't have to open really wide here, but make sure that you are doing quality movement. Okay, and this is 3, 4, 5, 6, 7, 8, 9, 10. And that is external rotation of that stroke leg. And then finally, we are going to try to stretch that foot that is pointed down and stiff. We want to stretch it to bend up like that. So again, we're going to be on your couch and get close to the armrest. Bring that leg up, okay? And place that foot against the armrest of your couch, all right? So your foot is initially pointing down like that. Try to push that foot against that armrest to give it a good stretch. If you have good balance, just do a long sitting here. But if you don't, just lay or sit up against your armrest and use your belt to stretch that foot. Okay? Put the belt around your foot and try to stretch that foot to a more pointed position like that. Okay? Be patient here again. Now, once you're able to do that more easier, to bend that foot up easier, try to do more active dorsiflexion or pointing the foot upwards. If you have a little bit movement, you can assist it with your belt. Now, if you have better strength, if your foot and ankle is stronger, you just actively move that foot to point up. All right? Let's try to do about 10 of that, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now again, if you can't do that yet, use the belt to assist that foot in pointing up. So those are the exercises that I recommend that you do at home if your leg is spastic, rigid, and difficult to bend. Try to do this every day. Be patient until it is easier for you to move that leg, or you have better control, or it is more mobile. If you have any questions, suggestions, comments, just type it down below in the comment section. And I noticed that a lot of you watching my videos have not subscribed yet. Click on that subscribe button. And if you see that this video is helpful, has value to you, give it a thumbs up, okay? And just a reminder, consistency is the key and never give up. Until next time, paalam!